Hello, my name is Leigh Pansch, and I'm a nurse practitioner practicing in the field of dermatology. July is Staying Safe in the Sun month, and I really think it's a great opportunity to spend some time talking about some of the misconceptions that I hear on a daily basis about sunscreen and how to stay protected in the sun. One of the most common misconceptions that I hear on a daily basis involves sunscreen application. The American Academy of Dermatology recommends application of a broad spectrum sunscreen with at least a sun protection factor of 30 or higher to the entire skin surface anytime you've been outside longer than 15 minutes. And then you really want to reapply every 2 hours when you're in direct sun, or hourly if you're swimming or sweating. Damage to the skin can occur in many different ways. And I think one of the more common ways it presents is a freckle. So when you see freckles on the skin, it's a really good barometer of the type of sun exposure that your patient has. Secondarily, we can see things from precancerous changes like an actinic keratosis, which is a scaly little lesion, typically a papule. It's often raised off the skin and it's on a red base. To the non-melanoma skin cancers like squamous cell carcinoma, which is the second most common form of skin cancer that we see, and basal cell carcinoma, which is the most common form of non-melanoma skin cancer that we see. All of the non-melanoma skin cancers come from chronic cumulative sun exposure. But basal cells, they're just skin bullies and they're very slow growing. A squamous cell carcinoma, it gets your attention because it's hyperkeratotic or very scaly. You can't pick it off the skin. It's fast growing. It's often tender or painful. We want to cut these types of skin cancers out and we want to identify them quickly. And of course, there's malignant melanoma. The good news is we have so many amazing therapies that have been identified in the past few years, and we're thankful for those life-saving treatment options. At the end of the day, we do well to understand that we must apply sunscreen anytime we're in the sun. And we know we've succeeded when we look at sunscreen in the sun the way we do our seatbelts in cars. It happens every time and every day. To learn more about protecting your skin, go to wechoosenps.org or speak to your healthcare provider today.